Good afternoon, everyone. I want to first start off by thanking everyone for joining us today. My name is Marco Giordano, and I am your CEO. We are all happy here, all of your panelists are happy to be here with you today to share an update and information on our response to COVID-19. As we all know, we've been working differently as a result of the COVID-19 pandemic. During the past 6 weeks, we have seen our community come together in so many amazing ways to provide support and to work together to ensure the health and well-being of each other. I want to thank each and every one of you that are on the call today and those of your coworkers that were unable to join us for all that you're doing for each other and for the people that we support during this time. 6 weeks of this new normal has also heightened levels of fear, anxiety, and concern around your health and your health and safety, as well as the health and safety of your family and the people that we serve. We all want to be safe as we are also exposed to environments that feel unsafe every day. COVID-19 has affected all of us. While the impact on each of us is different, it is real for each of us. I ask that we be kind to each other during this time. I ask that our values provide the strength and the commitment for us to move forward together. Organizations throughout the country and throughout the world were impacted by COVID-19. We were impacted along with many other organizations like RHD. The world was not prepared for such an event, and we could not have prepared for such an unprecedented event. However, we have responded and continue to respond as best as we can given the fast changing COVID-19 environment, while we also recognize we could have done some things differently along the way. With this learning and continued collaboration, we will be a stronger organization on the other side of this pandemic. We are also beginning to understand the impact that COVID-19 will have on how we operate in the months ahead. As suggested by government, we will be operating in a COVID-19-like environment wearing face masks, taking temperatures, practicing social distancing, and other protocols for a period of time. State and local government will introduce changes slowly and in phases, and we will be developing our plans to reopen RHD consistent with those recommendations of government and of our funders. The duration of the phases is unknown. However, we know that COVID-19 will have a lasting impact on what we do, as well as how we do it. The related support that we are providing to each other and the people we serve will also need to continue. I'm certain that together we can do this, and together we will do this. Today, we will be sharing with you the support and resources or information around the support and resources we are providing that are focused on your health, safety, and well-being. It's important for you to know that we continue to evaluate and prepare for what will be needed long-term as well. We will also be demonstrating today how to utilize PPE and take temperatures. And finally, we will provide an opportunity for those on the call to ask questions. With that, I would like to pass the mic to Sean Mott, who is facilitating our meeting today. Thank you.
Thank you, Marco. As Marco stated, this is an opportunity for us to share with you our response to COVID-19. For our meeting format today, as a friendly reminder, all callers on the line are muted, and the only faces and voices you will hear is that of the panelists. You are encouraged to participate in this weekly call, and one of the ways in which you can participate is through the question and answer period. Throughout this call today, you will have the opportunity to share your questions in one of three venues. You can send a question via the chat feature that's a part of this format. You can also send a question through your voice, and you also have the option for sending a question through the COVID-19 email address, which is, and I wrote it down, and I'm trying to look where I wrote it down so that I can share that with you. I thought I wrote it down. RHD_COVID_19 at rhd.org. With that said, I'm now going to pass it on to Baroness Martin, who will share with you information about employee support. And she's followed by Pam and then followed by Rebecca. Baroness? Baroness, you're on mute. Thank you.
Sorry. Good afternoon, everyone. My name is Baroness Martin. I'm the Vice President of Culture, Diversity, and Inclusion, and I'd like to take an opportunity to thank all of the staff for the amazing work that you continue to do every day during these very trying times. It is really a critical time, and all your efforts are valued, and I will say that together, working together, we will put Together We're Better to a whole nother level. So thank you. Today I'd like to highlight an employee by the name of Pauline Murray. She's an RHD employee and a cluster director for the in-home supports IHS People on a Path in RHD Boston. People on a Path is a life skills development initiative from RHD Boston that highlights community members, artists, businesses that are all working together to promote social inclusion, employment possibilities, and leadership skills to the ID and PD and autism communities. IHS supports over 30 individuals who live in their own home or with their families. Pauline Murray, our hero this week, as many are out there, Pauline took it upon herself to cook Easter dinner and then drove throughout the area to deliver the dinners to all the individuals in the individual support services. This replaced the usual group gathering that they have each holiday. And after making several deliveries, Pauline gathered virtually with each of the individuals and shared the meal. Pauline never ceases to amaze us with her willingness to go above and beyond. This week, we want to say thank you to Pauline Murray at IHS in RHD Boston. Now, yes, give her a hand. Thank you. Thank you, Pauline. The employee support domain is a cross-domain of multiple support components and a group of dedicated staff that are working to combine and coordinate efforts and resources that provide physical, emotional, psychological, and financial care for our staff, and to ensure that our staff are feeling safe and taken care of. Some of the ways that we have been collecting information in order to provide more resources for our staff has been through a survey which is closed, and we are now in the process of assessing the comments and some of the things that we received so that we can continue to work on how to best provide supports for the staff in our community. We also are thinking on behalf of, we're also thinking about wellness and well-being and other ways that we can provide staff safety for our staff and our employees. With that being said, another of the components is through the trauma-informed care and the DSIC teams that are coming up with different ways to help provide support as well. And so I'm going to pass the mic to Pam Kaznitz, who at this time is going to talk to you about what they're doing and the office hours that are being available to each of the people in our community. Thank you.
Hi, everyone. I'm Pam Kaznitz, and I am a clinical director for the Behavioral Health and Housing Division and a member of the DSIC team. Now, I know that everybody knows what DSIC stands for, but just in case you need a reminder, DSIC stands for the Department of Clinical Innovation and Quality. And I want to take a few minutes to talk about one component of our overall employee support effort. Members of the DSIC team have been holding and are continuing to hold what we're calling open office hours or wellness check-ins. The purpose of these meetings is to help us as a community process the emotional impact of this crisis for ourselves, our families, and our coworkers, as well as provide a time to discuss the impact on the individuals we support. Examples of just some of the things that have come up so far in these meetings are coping with stress and all the changes that all of us are experiencing, sharing strategies for self-care, and all of the innovative and creative ways that so many people out there are utilizing to support the individuals in our programs. These meetings are a place where we can come together, share, and realize that we're not alone in everything that everyone is feeling right now. Each week, members of DSIC have dedicated time scheduled for these meetings. These meetings are available to all staff from our programs, and there's also a weekly meeting for our shared services employees. The times and links have been sent out to program leadership, and we will continue to send out the info. If you are interested in attending any of these meetings and you don't have the information, please reach out to your unit director or supervisor. And be on the lookout for communication from the Trauma-Informed Care Committee. Personally, I am so happy and proud of all of the work that we have done over the past couple of years around trauma-informed care, because we need those principles right now more than ever. Thank you so much.
Thank you, Pam. We'll now pass it to Rebecca, who will provide us a presentation on PPE and the use of PPE. Rebecca?
Hello, everyone. My name is Rebecca Bixby. I am a nurse practitioner and the Director of Primary Care and Executive Clinician for FPCN. I've been asked to provide a demonstration, a brief demonstration of how to put on PPE. And PPE, I'm sure you know, is personal protective equipment. This can consist of anything from mask to gown, gloves, face masks, goggles, booties, and hair nets. So I have most, if not all of those today. There are regulations for donning and doffing, those are the technical terms for putting on and taking off PPE that have been put out by the CDC, NIOSH, and OSHA. There are multiple steps and there is a certain order to put them in. So the way I like to remember the order is cover your body first and then your face. In terms of surface area, it's very important to cover the largest area first. So that would be your gown. Gowns can be very different.
Rebecca,
Yes.
Can I interrupt for just 1 second?
Absolutely.
Brian, can we make sure that folks can see Rebecca? Can we put her full screen?
If you're not able to see me full screen, you could also on your own Zoom hit speaker view, and whoever's speaking should show up in that large window on your Zoom.
Thank you,
Should
Rebecca.
I continue?
Go for it.
Okay, I can see myself, so I think I'm here. So this gown is just a plastic gown and it goes over the head. There are also yellow gowns. There's multiple types of gowns. The important part is that there will be a part that goes over the head and needs to be tied here or Velcroed, or this one is a simple slip-on. And then you put your arms through. This one actually has a thumb hole, and that is to get a better seal with your gloves. Any gown should be tied in the back or affixed in the back, and that is because your back will not be as exposed to whatever you're dealing with and handling as the front. So I know sometimes it's tempting to pull the ties around and fasten them in the front and cinch it up, but please don't. Please keep that in the back where it will be less contaminated. After the gown would be your mask to cover your face. So you've covered your body, now you want to cover the majority of your face. I know a lot of people are wearing different masks these days. Whatever type of mask or facial covering you have is fine, as long as it has been deemed appropriate by your facility. So I have several. that I will show, so please bear with me because it seems straightforward, but they have their little tricks. This type of surgical mask, the white part, the white side goes against the face. The color goes outward. There are pink ones, there are green ones, there are blue ones. So the more colorful side should face outward. There may also be this comfy foam piece here that is inward on the white side on your face. And the importance of this is that these masks do have dual ply technology, so there is actually some science as to how it's filtering the particles. So with these, you simply tie them. Tie one up here where my bun is, and tie the other one around your neck at the bottom. So always tie it. Any mask should have an anchor at the crown of your head and around your neck. So that's this type of mask. There are also these loop masks, which you see a lot of people wearing. This happens to be a KN95 mask. Also fine. Very simple to put on, and then seal it at the top. So this metal part fixes around your nose. And you should have a good seal here. So that's this type of ear loop mask. And always make sure you're pinching the top around your nose. The last type I have is the N95 medical grade mask. You see these a lot in the healthcare providers and hospitals. We try to reserve these for people who are performing potentially aerosolized procedures, so they may not be available to you. But if you do have one, these are very important to do the top band first at the crown of your head, and the lower band second around the neck. And then you should get a good seal, and again, pinch the top here. If you're testing the seal on any type of mask, if you blow out, you should not feel it escaping, not feel air escaping around the edges of the mask. All right. So after the mask, the gown, and the mask, if you have a hairnet and booties, those should be on first. I don't have either of those to demonstrate. Your feet and your hair can potentially be infectious if anything lands on them. So if you do have those and want to use them, that's great. After the mask would be a face shield. So if you have a face shield that comes down, it's like a headband and has a plastic sheet. Those also we try to reserve for aerosolized procedures. However, you might have access to one that would come next. The face shield I have is a mask shield. So you just double up with this. And now you have a shield. After all of that, you'll have your gloves. Now, I used my gloves, so I actually don't have them today. But the gloves, we all know how to put them on and get a tight seal around the gown, whatever type of gown you're wearing. Now for taking off, you actually just go in the opposite order. You're gonna peel your gloves off first from the inside, because those have been exposed to whatever you're working with. And after that, so your gloves are off, you'll take your gown off, untie it in the back, and peel it off from the inside. So you want to hold it on the inside and peel it so that you're not touching the outside with your hands because the outside has been contaminated. Same with the mask. This is potentially contaminated. you don't want to touch this, grab it and pull it off, because first of all, these will get all tangled up. But also, this is more infectious than here. So you'd simply take this one off and the bottom one. Leave on your face protection until you leave the room or until you're away from the contaminant source. This is what you take off last. And of course, before and after, you're always using hand sanitizer, whatever type of alcohol-based sanitizer is available, or if you don't have it available, a sink with soap to wash your hands. The only other thing I would add is that if you are wearing gloves in the room with a patient or someone who is a potential exposure, and you get something on your gloves, you can also perform hand hygiene with gloves on. You don't have to take them off and throw them in the trash every time. If they are grossly contaminated, yes, but if it's a drop or a spray, then you do the same thing with your gloves on. You just put some hand sanitizer on and rub them together and make sure to get in the corners, and then you can continue to use them to try to conserve your PPE. And also reducing the contamination risk if you're going to unglove and then put new gloves on in the presence of a potential exposure or contaminant. Masks can also be reused as long as they are not grossly soiled. If they become wet, if they get blood or body fluids on them, then they are done and you throw them out. However, if not, you can reuse these. There are also washable masks that you may have access to, and that's fine. If you are going to reuse a mask, you should put it into a paper bag or some type of aerated space to dry or to remain with air circulation until you're going to reuse it. Don't tie it up in a plastic bag where it might get moist. I see a question about discarding PPE. If there is a Stericycle bag or a red bag, as we call it, in the hospital or healthcare facilities, they should be discarded there because it is potentially infectious material. If you don't have that at your facility, simply designating a separate trash can or area where it can be discarded into a bag that is sealed or has a sealed top or cover, not an open can, that's where it should be deposited, and that should be discarded of separate from anything else.
And Rebecca, this is Sean. I see that you're fielding the questions from the chat feature, and I may not have informed you of this for this call. We will typically do each of the presentations first, and then do all the questions and answers collectively. So we have one more point to cover, and then I'm sure we'll have questions for you as it relates to your demonstration. But before we move on, was there anything else that you wanted to conclude regarding your presentation for the audience and listeners?
I think the only other thing I was asked to cover is the temperature taking.
Excellent.
So I will wait. I'm a supreme multitasker, so I will refrain from looking at the chat. And I'll wait and hold that for the end.
No. Well, go ahead. Yes, you're going to do the temperature now?
Sure.
Excellent. Thank you.
So this is the temperature strip that I was given that I believe has been ordered for the facilities. And this is super simple. I think this relates to a temperature protocol that will be coming out in the next day or so from RHD. And the idea is simply, there's guidance being given in many states that prior to your shift, you should take your temperature in the morning. And for our employees, we're also just asking people to check symptoms and let us know if you're sick. Above all, now is a very good time to be self-aware of your own limitations. And I know many of us as healthcare workers are givers and carers, and you might feel like you need to get into work to take care of the people who are depending on you. However, if you yourself are ill and potentially infectious, this is a very good time to try to stay home and to just try to take that time for yourself. So if you have a thermometer, an oral thermometer, you can take your temperature using that. If not, these may be made available to you. With these strips, you just place it on the forehead and hold it at either end for 15 seconds. And then it's hard to see, but there are numbers along here in a gradated format, and there is a green color that will show up at the number that is closest to what this is reading as your temperature. I don't know if it's been 15 seconds. You're supposed to read it while it's on your forehead, so that is a little bit of a conundrum if you're by yourself. If you have someone at home who can read it for you while it's actually applied to the forehead, that will be the most accurate reading. And when you're not using it, it should be kept inside of its case, inside of the paper. It's a little plastic case. Sean, I think that's all that I was asked to do. So if you have any further questions, please feel free to put them in the chat or ask your supervisors at your sites. Thank you so much.
Thank you, Rebecca. And as you noticed, there was quite favorable feedback about our coordinating this demonstration. So thank you for taking the time to walk us through those various steps. That concludes the agenda items that we have scheduled for today, and which typically leads us into the process of doing the Q&A. I don't think I mentioned this as a reminder of the way we've managed this process. So I'll spend a couple of seconds just to share that, and then I'll go ahead and start asking questions to our various panelists. We typically field questions throughout the call in one of three ways. We'll collect them from the COVID-19 email address, the chat feature, as well as your voice. We organize those questions based on who we believe on the panel would best be able to respond to that question, and then we go ahead and provide a response. We try to answer as many questions as possible within the time allotted, and if we don't meet that goal, we will typically field those questions at a later time, most likely within a week, where we'll respond to the entire workforce as to the question and the answers to those questions. So with that said, I'm going to go ahead and start with the first question that was received. This question is about hazard pay, and it can be directed to Linda or anyone on the hazard pay committee. Why isn't everyone getting hazard pay if we are all at risk?
So the first thing that I would say is that this has affected every program in different ways, and want to just acknowledge that. Last week I had been able to talk about the hazard pay, and that being our first step of trying to address these rapidly changing environments. So the programs that had positive cases and were under isolation or quarantine, those staff that had been working there were able to, I believe now this is our second run of hazard pay, of getting that in. We're thinking we're doing a pretty good job of identifying program by program who falls into that category. But we're also saying, because things are changing so fast, if we've missed it, let's correct it. Reach out and let us know if you think there's a situation. So hazard pay is underway. I believe what other people are saying is really more what we're talking about as incentive pay. And that is that we are all in this together. We are one community that is struggling with this same issue. Each time we go outside of our house, each time we go to a store, each time we go to work, there is potential for exposure. And that is something that we have taken very seriously and are working very hard to come up with a solution. It is part of our struggle is that we are wanting to look at our whole community, our entire picture, and our future as well. So that is something that I wish that we had that answer today in hand to distribute, but we don't, and we are working on it. And I don't want to, I know we had talked about this multiple times. If there's anybody else on the call that would like to address that as well, or I can also take any other questions.
Thank you, Linda. Oh, go ahead, Alicia.
So I don't know if this is the time. I think that I just would want to add to what Linda is saying a couple of things. So there is a committee, as Linda's referencing, that is made up of your chief program officers, Brandon and Linda, your directors of finance and operations across the corporation, the executive director of our health network, Emily, and Deanna Serwin, who's their CFO, and myself. This committee has been looking at and addressing the issues of hazard pay, incentive pay, as well as other payment arrangements we may be getting from our funders, which we have been waiting and receiving daily. They're trickling in from our funders, and not all of them, but some sporadically here and there across the corporation. So as we have been receiving all the information still coming in and not completely in from our funders, we've been trying to figure out what we can provide in terms of support for our employees across the corporation. So as Linda said, the first thing that we chose to tackle was the hazard pay, because that was an emergent situation where we have staff that are working with consumers who were COVID positive and needed to address that right away. That's not to say that every other thing that we want to try to do and need to address as a corporation was not equally important, but we did have to kind of take what we could prioritize and address with a certain level of urgency. I think that anybody could understand the need to make sure that we address that first. And then we have been looking at what we are calling incentive pay, because hazard pay is typically used when you are currently in the known situation, and that is those staff who are working with individuals who are COVID positive. It does not mean that there's not risk associated for anyone who's out and about in the community, who's providing support or services to anyone. And you know, just the same as if you were going to the grocery store, there's risk associated for anyone, which is the challenge that we have as a whole, as a country, but also as an organization. But we're still looking at incentive pay and trying to understand what our capacity is. As Linda said, our programs are so diverse across the corporation. Rebecca was giving you a demonstration of a number of different forms of PPE, and she's in a healthcare setting, which is something that RHD has, very different from the community-based service or residential-based services and programs across 14 states. So I think that there's a level of complexity that is required. The committee is communicating and with one another, as well as trying to understand, and we get information and feedback, not even just from our staff, but from our other sources of what others in our industry are doing. And then also some of us are connected with other healthcare settings. And so I saw someone put into the chat, you know, listen, there are some healthcare settings that are not even getting PPE. And so, you know, we're connected and trying to understand what's happening in terms of hazard pay and incentive pay. And there is no one consistent approach that's happening across the country at organizations like ours, or organizations, even healthcare settings. There are some healthcare settings where they're not getting it either. So we're still trying to figure out. It's quite complex. And just wanted to put that out there for the staff across the corporation, that we recognize that when you're getting up every day, you're coming to work in situations where you don't know. It's one thing to come where you do know that your consumer is COVID positive and you're still coming to work every day, and we're addressing that, and that's what Linda's talking about. But even when you don't know what you're walking into, we want to try to figure out a way to acknowledge. Baroness has talked about some of the other supports that we put in place, but we recognize that if we can find a way to financially acknowledge our staff, in addition to all of the other things that we're trying to do, the COVID relief fund, you know, some of the other supports, the well-being efforts of DSIC and the well-being team, Christy Katz-Friedman, all of these things that we're trying to do to support our staff won't ever take away or can't replace the chance, you know, the risks that they're taking every day that they come to work. So again, it's a complex, it's multifaceted, meaning like we need to try to address it in numbers of different ways. And I would invite you to continue to stay connected with your chief program officers, because they are part of that committee and are part of helping to make the decisions and give feedback as to what the decisions could look like, should look like, as well as the rest of us that are on that committee. So it is a collective effort. It is a collaborative effort where we all kind of are putting our heads together in this wonderful think tank to try to understand what the needs are and also to come up together jointly with solutions that will address the requests and the needs across the corporation, knowing that no matter what we do, it just would not possibly be enough. It could not possibly be enough. So I just wanted to kind of put that out there, Sean, because I know that there's a part of this that is hazard pay, but there's also a part of, I think, what people are confusing in terms of hazard pay is incentive pay. And we want to make sure that we're clear so that we're communicating with each other effectively what the needs are and what our attempts are to try to address it. So I'm hoping that that answers some questions, although it's not in detail and it's not specific and it's not concrete plan, and yet the same way there is for hazard pay. But I just wanted to make sure that we were all clear about that. And then if they have questions, who they can go to, well, you know, the chief program officers within their programs.
Yes, thank you, Alicia, for that detailed response, which also accounted for just the multifaceted ways in which the organization is responding. This next question kind of falls within that category as well. This is perhaps a question for both you, Alicia, as well as Linda. The employee referenced the Families First Coronavirus Response Act, which is an expanded sick pay and paid family leave for employees of employers with under 500 employees. The employee wanted to know, will RHD follow this federal precedent and fulfill their responsibility to provide adequate compensation and relief to employees with young children and vulnerable family members? So they referenced that act and wanted to know what RHD plans to do in response to that act, or similar, or kind of modeling after that act. Alicia and Linda, perhaps?
Sure. I'll take that because I took that, I think, probably the first 2 or 3 weeks after that was passed and answered some of those same questions. So the first thing I would definitely say is that, you know, we've had this conversation, I think, on this call in previous meetings, and I definitely, if there's anybody, maybe there's different people signing on, so on and so forth, I really encourage people, if you get a chance and you log into Okta where you address your loss and to put your time in, that you click on that COVID-19 site, because I do think that there's quite a bit of information there and it would be a lot of help and resource for people. And then again, we've always asked, if you're on this call or in this meeting, please share this with your colleagues who are not on so that they can have access to the same information. So a few weeks ago, when the act actually passed, we came on to this meeting and shared that, again, as whoever was asking that question, I'm not looking at the chat right now, but whoever asked that question referenced the fact that the Families First Coronavirus Relief Act really was for corporations or organizations that had 500 or fewer employees. So it did not apply to RHD because of the fact that RHD has well over 500 employees across the organization. I think sometimes if you're in a particular program, you may not recognize the number of employees that RHD has across the country in all 14 states. But we have over 5,000 employees, and so that act did not apply to RHD. And yet at the same time, we've done some things that the act that captured the spirit of the act already. We did those things, and we're now at a juncture where we need to figure out, and that's part of what that committee and the employee resource committee, support committee is trying to figure out what other things we can do. So the things that we did that while we were not required because the act did not apply to us, but it captured the spirit of the act, we advanced sick time to employees that they were going to accrue through this fiscal year. Again, not something that RHD was required to do, but something that RHD did even before that act was passed, not knowing whether or not that act was going to apply to us. And even though we found out that that act did not apply to us, we still held to our obligation of advancing that sick time for employees to be able to use in advance of earning it or accruing it through December of this year. December 26th is the end of the PTO year. The other thing is that if an employee needs to go on FMLA, that is something that is still in place. The existing rules that we are under from the federal guidelines around FMLA are still in place. The expanded rules from The FFCRA do not apply to RHD, but the existing rules around FMLA are still in place, and we made sure that employees are aware of and understand that. The other thing we did was we shared with employees that we were going to continue their medical benefits if their program was closed and they were not able to work, that if they apply for unemployment, we would continue to pay their medical benefits. Again, not something that RHD was required to do, but early on made the decision that we did not want our employees to be without medical insurance, even if we are not one of those lush corporations that has the ability to say, we're going to just pay everybody. I mean, I think that that would have been definitely something we would have loved to have been able to do, but recognize that that wasn't something that was in any way realistically possible, but that we were going to continue the benefit portion of employees, and that we would allow employees to catch up on their portions after they return to work full time. So again, something that RHD has done that captured the spirit of the FFCRA, even though we weren't required that did not apply to us. So those are some examples of some of the things. I think that the question was twofold. One was, the first part of it was, what are we doing to honor the FFCRA? And again, it's not something, because as the person who wrote it said, we have more than 500 employees, but we have done and continue to do some things that do honor the spirit of what that act was trying to accomplish, even though it didn't apply to us, even before the act actually passed. So I hope that answers the question. Give some examples. Sean?
Thank you, Alicia. Appreciate it. The next two questions are regarding PPE. The first one is, and perhaps Sandy, possibly even Stephanie could respond, is staff going to get different masks for those of us who are still working with clients? The ones that were provided were not reusable. So if you could answer.
Sean, you got it. You have to repeat that question because I can't hear you.
My apologies. I'll adjust my volume. Trust that's better.
Yes.
Is staff going to get different masks for those of us who are still working with clients? Those that are, the ones that were given were not reusable?
Oh, yes, absolutely. We have a lot of masks right now. There are some masks that are reusable and some that are not, and I'm sure that you'll know which ones are and are not. But at the same time, we hold a lot of masks, but we also, and we send them out according to the requests that come in. So keep those requests coming in. I know that some people are emailing me directly and some people are emailing Sheena directly. I would continue to ask you to fill out the form as to what it is that you need. So if there are masks that are only worn one time only, then you should have definitely the next set of masks coming your way. We're also asking, and we continue to ask, in the areas or the states where you are, that you also look out for masks, because I think that in Walmart and different places, they have these things coming in. You just have to sort of be on the front of the line. You have to, talk to the managers of these stores and so forth and so on. We're also sending out links to the various distributors. So please be on the lookout for that as well, because I have a lot of the programs are now ordering for themselves, and we are also keeping a lot of things for emergency use, also like the N95 masks and those things for those who are infected.
Thank you, Sandy. As just a follow-up to what you just stated, you mentioned the importance of sending an email to demonstrate your request or need. You also mentioned completing the form. Could you talk briefly about the importance of completing the form, or why we're using a form?
We're using the form for a number of different ways. One is to track who needs what, and to also track, who are being most effective, which programs are most being effective in what area. We're also using the tracking form to continue to look at the cost. We definitely have to keep up with how much all of the PPE is costing and where we're going to build the cost to. So we're asking for that as well. And we're also asking for the forms so that we can keep up with our inventory, so we know what we need to reorder, and what is most important where.
Thank you for that additional detail.
Hey, Sean,
yes.
Sean, it's Bernie Glavin. Can I just jump in on that also?
Most definitely, Bernie.
That is 100% accurate. But if programs shop locally and they find a large group of masks or something like that, it's important that they also share that information with Sheena, because like Sandy said, we're updating inventory and where we're shipping things on an almost daily basis. So if you've gone into Walmart and you bought 3 or 4 masks, we don't necessarily need to know that. But if you've gone in and you bought 200 masks, that definitely will, maybe keep us from shipping something to you and redirect it to someone else who has the need.
Especially in the various areas, like if you've hit the jackpot somewhere and you have programs that are like 2-hour drive away, I would ask you to go ahead and get as many as you need and notify us so that we can notify the folks in the next town over or even the next state over, because it may be easier for them to drive and get them, because we are actually sending them out and we're overnighting them, and that's also a cost. But if you're able to do it where you're at, I think that would also be very helpful.
Right. The other thing that Sandy mentioned was about costs. And again, costs are always something that we have to deal with, but it's important that we use the PPE form so we can track how much it's costing each of the programs, because some of the funders are coming back or saying they're going to come back to us later and ask us, how much did COVID supplies cost? How much did it cost you for staffing? So we're going to need to track that stuff in hopes that we're going to get reimbursed. We don't know that we're going to get reimbursed, but we've got to have the information so if the funders come back later and ask us, that we have an accurate number in hopes of getting reimbursed.
Thank you, Bernie. Thank you, Sandy. It sounds like that form is an essential part of the process to help with the tracking and the costs associated with purchasing PPE. This is one more question regarding PPE. Is it possible to provide aprons and N95 masks for DSPs?
Oh, absolutely. If in fact you're in a situation that warrants it, so by all means, make sure that you're filling out the form and you're getting it in. And those cases will always be bumped up to the top, because if you're in a situation where there is a quarantine or isolation due to a positive, what have you, we'll definitely make sure that you have them, but we need to know that you need them.
Right. Thank you, Sandy. The next question is perhaps for Alicia and Linda. Have you considered extra compensation for salary employees, particularly unit directors, who are putting in significant amounts of overtime due to COVID-related staff shortages? And I want to also add that this could possibly be answered or fielded by Brandon as well.
I could start with that. And what I would share is my experience over the last few weeks, even more so last week. I think we saw a big surge in the amount of programs that had COVID activity. It was a tough week across the corporation last week. And what I would say is, though some things are very similar in programs, some variables are very different. So I would ask that we have the conversation, because each solution that we are finding is a little bit different per program. Some we're bringing in temps. Some supervisors are coming and staying. Some we're doing longer shifts with less people. So I would just say, reach out to your service line director and your unit director in partnership with Brandon and myself and our financial managers, and we can have the conversation for your particular program. Brandon, I didn't know if you had more that you wanted to add to that.
Yeah, no, I think you said it well. I think what we have to understand is it's going to be on while we would like to think it's a little more global in those kinds of approaches, the reality is everybody's case is a bit different. So I don't want to say that we're going to treat people, in different ways with regard to compensation. That's not what we're saying. But we really have to look at each case specifically. And if there's a trend for a particular item, then we'll bring that up with our committee when we look at it. But I think it's very difficult to just be off the cuff and say, you know, we're going to do thus and so, because things are changing so rapidly. And I would agree that, you know, the folks that probably felt the impact the most a couple of weeks ago has shifted a bit. Now, you know, the impact as our cases grow and spread across different areas of the organization, different levels of workers are experiencing it in different ways now. So what, you know, again, if we focus on, we have to be cautious to focus on the whole team, because everybody's involved at this moment. And again, it's a great time to say that it takes a team to get through this, and it really does, from our front line to the top level. Everybody has really got to be working together. Specifically, you know, you think about the residential programs and mobile programs that are really in it day in, day out. You know, our day programs, no different is the struggle when folks are shut down. So I think we have to work together and work on a case-by-case basis still, and just keep that flexibility right now.
If I can, Sean, and maybe
Yes.
ask Alicia, it might be helpful for folks to understand some of the efforts around recruiting, recognizing the staffing challenges that we have currently, to share some of those efforts with the larger group.
Great, thanks, Marco. So a couple of things that our HR recruitment and retention team have been working on. One, we recognize there are some areas, not all. Again, I just want to remind everyone that, right, so one of RHD's 3 basic assumptions, there's no one right way to manage corporate needs and resources, right, along with people are essentially good and everyone's of equal human worth. But the reason why it's important to understand there's no one right way is because of the fact that RHD is a multi-state, multi-service line, multi-service type organization. If we all just had residential IDD services across all 14 states, we could come up with one plan, and that would kind of be it. So we recognize that we need to be able to have a multifaceted and a flexible approach to addressing the needs as they come up. So that being said, one of the approaches we've taken is that if staff are in programs that have closed or have had significantly reduced hours and are in proximity to a program that is remaining open, that we are trying to match those programs and staff. And I know some directors have been doing it, as well as the recruitment and retention team has been trying to survey directors to say, hey, do you need staff? Where do you anticipate the needs to be? Are you seeing call outs? Like, what are your needs? Because we do have staff who are at programs who are closed and they're not able to work, who want to work, who feel like, you know, they want to be able to work. So that's one approach to trying to match them up. The other is that our recruitment and retention team has been trying to use all of our platforms, our social media, our career sites, to gain interest from individuals who are outside of RHD, who are out of work. And there's quite a few people who are out of work and are looking to work. And then we've also begun to be a little more creative in how we do the onboarding virtually, given that we have the social distancing guidelines. So people have gotten used to the fact that we have to apply online, you have to go through your process online, but doing interviews via technology, doing onboarding and new hire paperwork using technology as much as possible, wherever possible, is another resource. And then we've established relationships with partners with various staffing organizations and agencies across the country that allow us to be able to, wherever we have a need or a gap, to be able to do so as well. We are, one other thing, experimenting, not experimenting, but kind of trying out, piloting is what we would call it, identifying and developing a pool of available on-call staff that would be available, people who are maybe working elsewhere, who are interested in picking up a shift here or there, that would be available for us to pull into, so that RHD could have its own ready-made internal pool of people rather than always going outside to a temp agency. These people would be trained. They were people that we know, that kind of know RHD and understand our consumers. So these are all some of the things that we're looking at, and different approaches. They're varying based upon where and what type of service we're talking about trying to fill the need of. But as you can see, there's a lot of different approaches to try to address, making sure that we have available staff that are definitely saying they want to work and are interested in working in areas where we need staff. to be working.
Thank you, Alicia, for the detail. This question that's within the queue is similar to what you just shared. And I just want to share this question with Brandon and Linda to capture if there was anything that you shared, Alicia, that should be said differently or added. Why aren't divisional leadership or other shared services staff members assisting in programs facing staff shortages due to COVID?
I mean, I would hope that we are, that folks are doing that, you know, and assisting in different ways. If you're asking, I guess that the question is getting to why aren't those folks doing direct support services? You know, that's a different topic. So if that's the question, I think, you know, hopefully we're assisting you in other ways. I don't anticipate, you know, just in general that we would ask our regional staff to go staff a home, but in cases where it's necessary, I know that we did have that discussion, and I don't want to speak for Linda, but I know Linda, we both talked about that specifically with Bernie and Sandy, and that may be required for folks, you know, and if it was, we would need to step up and folks would need to try to do that to better support the client, the consumers and the staff. But the reality is, you know, we're going to do everything we can to support you, you know, to get staff into the sites, into the homes as best we can, and we work together through that. You know, I don't, yeah, we should, everybody that's trained appropriately, let me caveat that by saying we want folks that are trained to do that support appropriately. Obviously, there are some easing up on some training requirements here and there. I wouldn't really say, I mean, I'll probably hear about that later, nobody's really easing up on it. Truth is, the government's not easing up on it, but there are expectations that have been softened. So there are ways to let people help in houses that may not have went through the normal training procedures 2 months ago. But the reality is nobody wants that. It's not safe for consumers. It's not safe for staff to have people in the homes that are not trained and ready to go. You know, Bernie and I have talked a lot. He's ready to jump in. You know, I'm getting teased, putting him on the spot. But it's been a lot of years for both of us, right, to do that. I think both of us would have a tough time and would not do nearly as good a job as you guys would be able to do. So again, I don't try to get around the question.
And I also think we need to make sure we have a strong backup for the staff. If we all jump in, who's gonna order this or that? Who is going to make sure that we're following the CDC guidelines? Who's going to make sure that, so when you look at the various jobs that each one of us are doing, it's to make sure that we're available and holding staff down the best of our ability, to make sure that staff have what they need and that staff feel supported in any way that they can.
The last thing that I would add is I think absolutely people are ready to respond and already have. There are a lot of service line directors, assistant service line directors that have helped out in particular programs. Yeah. So yes, yeah, we are ready.
Thank you, Linda, Brandon, and Sandy. It sounds like there are some complexities and nuances to staffing in our homes, and those need to be taken into consideration as we're making decisions. Thank you for that. These two questions are to Rebecca, and it's related to the presentation, the demonstration, my apologies. The first one, can you speak to PPE use with an individual who tested positive and uses a CPAP machine? Rebecca?
I was just responding to, I believe, Susan in Boston about this, but if there's anyone else who has questions, CPAP machines can aerosolize the viral particles through the exhalation port. Therefore, they should be isolated as much as possible, even to the point of having their own room, if at all possible. It is important to be on a CPAP machine if you are COVID positive, because of course we need as much oxygen going into the lungs as possible. But there would be a risk to anyone in that room due to the aerosolization of the viral particles potentially coming through the exhalation port.
Thank you, Rebecca. And the second question, could you please explain again about the reusing mask and not putting them in a plastic bag?
So there are guidelines on the CDC website for reuse of PPE if you want to look that up. And essentially, it does describe what I explained, that unless the mask is wet or soiled, you may reuse it in the event of critical shortages, which is where many of us are. And the mask should be placed in a paper bag, or they do say a locker, essentially any non-contaminated enclosed space where it won't be handled or soiled in between uses, but where air can circulate around it. If it's in a plastic bag that is hanging in a locker in a room, that might be okay. Just not tying up the plastic bag and sealing it, because moisture may collect in there, and that would not make the PPE reusable.
Thank you, Rebecca. This next question is possibly for Tara. Is there a plan to capture this part of the meeting, specifically the PPE demonstration, to be shared with all direct care employees?
We do share or reshare all of our meetings. They go out Wednesday or Thursday each week, and they go out to all staff. So we absolutely encourage people to watch this each week. If our staff would like us to cut the video down to just the PPE presentation, we can absolutely look into that as well.
Great, thank you, Tara. The next question is for Sandy. It's regarding PPE. Is RHD providing all of this gear for staff? Where do we get gowns from?
Yes, we are providing gowns, but we again ask that that the different programs follow the links that we've given them for gowns. But when folks need gowns, and we do have them, we will send them to them, but they just have to fill out the form.
Thank you, Sandy. This next question is about PPE, and it's looking at the time it takes for a facility to get the mask. This employee was wondering why it takes several weeks to even receive face mask. They just received their request and it arrived on Saturday. So someone can talk to the length of time it takes to get the equipment, the PPE to staff. And then the second part of the question was also looking at, again, hazard pay regarding working health and welfare. So the first part is about PPE and the duration it takes to get there, and then hazard pay. Go ahead.
Yes, I can speak to that. You know, we are using various vendors to get all of the PPE in, but keep in mind we're in competition with a lot of different agencies like us, and even hospitals. So you know, once we get you know, a sign that there's some PPE in, they will oftentimes give us a 2-week delivery, and we go ahead and take that because there aren't any express orders coming in that we know of. So we continue to order, and we continue to take the 2 weeks out delivery because we are in very thick competition with all healthcare agencies at this point. So that's why we also ask that the local, you know, that you look out locally as well.
Thank you, Sandy.
If I can, Sean, just
Yes, Marco.
maybe if somebody on the team can help me here or correct me if I'm wrong, but I'm seeing a lot of comments or thoughts coming through around PPE in the chat, and I think there's probably some room for clarity. So that way we are all doing what we need to do in this moment to ensure that we are all as safe and feel as safe as we can. And you know, the many efforts that you're hearing about today that are being led by Sandy and many others on the panel list, and many of folks that are not on the panel, are really trying to ensure that the staff that are working with active cases of COVID are tooled and supplied with the PPE, the appropriate PPE that's necessary. And what you're hearing today is the challenge of, even in those active cases, because of the limited supply and the priorities to hospitals, that not all the PPE in all those cases is available at the moment that it needs to. And the team, through the reporting form and the constant connection through leadership, is making sure that those folks have what they need. There's another aspect of need within our organization, and that is for staff that are not working with known cases of COVID. But we will all agree that we don't know when COVID is present or not. And there's a feeling of risk associated with that. And there is a desire to have PPE in those environments. Unfortunately, there is not enough PPE to go around to all staff in all environments, full PPE. We need to make sure in those non-COVID environments that we are working with staff, we are working with leadership to make sure that we have the minimal amount of PPE that is required. And at a very, very basic level, that is some type of face covering, if not a mask, for all staff. That is something that we're hoping we can provide, but that is also something that I'm sure our staff and our leadership can get access to locally as well. What's key is making sure what our needs are so we can source our needs in the best way possible. So I want to make a distinction of active COVID cases that we're managing more centrally and the distribution of PPE to the need for us all to work together to make sure that all staff have, at a minimum, a face covering or face mask in working in the many different environments that we're working on in today where we don't have active or known cases of COVID.
Thank you, Marco, for that extended explanation regarding PPE. The next question is somewhat related, and it talks to exposure. And this question is for Stephanie. What about staff that tested positive and we all are exposed to it?
Hello, Sean. I'm not quite sure what about it, so I'm going to answer it in terms of what happens if a staff tests positive. So the standard is, it's the standard that we are getting all of our information from, which is the CDC, is that if you are exposed, meaning within 6 feet without protective equipment of someone who has a positive test for COVID, you're to quarantine for 14 days, assuming that you spend those 14 days asymptomatic.
Thank you, Stephanie.
If that doesn't answer it, take another shot. I'll try again.
Well, there's another question as well. It appears it may be from a different employee. And it talks to, do you still go into work if you find out that 2 staff that work in your unit was exposed to a unit that have been found to have been positive with the virus?
Sean, I think what you just gave us was a 3rd-degree contact. So let me just repeat it.
Yep.
You work with someone who works someplace else, they got exposed someplace else, and then they come to your workplace. So you want to do the same evaluation on what exposure is. So if you were exposed, as we just explained in the last example, you would evaluate whether or not you are an individual who has to be quarantined. As long as you have PPE, you would still be able to work.
Great. Thank you, Stephanie. The next question is around clarity regarding, I'm sorry, go ahead.
Just before we move on, I just wanted to offer that in the last few weeks, we've had many situations trying to sort that out because it can get very complicated. And just really wanted to say that June Hodges has been extremely helpful and instrumental in helping us sort that out, and that she is still a resource for us. So just to keep that in mind as it kind of comes up in any particular program.
Yes, we have counseling sessions with program directors various times throughout the day. If I can't, Brian McHale, our safety manager, can meet and discuss what to do, as well as Stephanie.
Thank you, Jen. Thank you, Stephanie and Linda. The next question is in need of clarity regarding when and how to take temperatures. The employee mentioned that last week it was said we should take temperatures before someone enters the home, which would be outside before entering Now it is being said that you could take it before leaving home. How does RHD want employees to manage the dynamic of taking temperature? June or Stephanie?
That's actually Emily. I'm going to defer to Emily and Rebecca.
Okay. Yep, excellent.
Hey everybody. So a temperature protocol is going to be coming out within the next day or so. And I think there are some state specifics that we're going to ask you to follow, but in general, we are going to be asking staff to take their temperature an hour before their shift because that gives people time to, if there is an issue, if it's high or if you have other symptoms, to talk to your supervisor about coverage. I think the question also asked about, there was something about visitors or people coming to the home, right, Sean?
Correct, yes.
So I'm going to defer to either Linda or Brandon, but my understanding is that there should not be visitors coming into the homes at this point. So if there are visitors, there's another protocol because they shouldn't actually be coming in, but deferring to Linda and Brandon to step in there.
Yeah, agreed. Thank you, Emily. We definitely want to be following our visitor protocols that were put in place a few weeks ago. And if you're having, just as a reminder, if you're having trouble with certain guardians or parents or otherwise that are attempting to visit outside of that visitor protocol, then please reach out to your supervisor or one of your service line directors or even Linda and myself. We would be there to help walk you through that, support you in that. We don't want you to be the front person that has to address that kind of a situation with a guardian or a parent. So please reach out to us if you're continuing to have trouble with that. If it's emergency personnel that are coming in, obviously, or a physician, they're going to be cognizant of that, of protocols, and we will be respectful and take all precautions coming in. So I'm not concerned that we would have an issue with emergency personnel. But again, if you did have, please alert us so we can be supportive to you in that process.
Other thing I would just, I would add and agree that there really should be no visitors unless for emergency situations. The other thing around taking the temperatures, our goal and desire was to make it the best possible situation for the employee and for the community that you're serving. So not to have somebody come into work, realize then they have a temperature, but to do it an hour before shift so that all around we have time to work through what does that mean for the program. I also know it is difficult to find thermometers. And so we did get one shipment that we're going to be working on distribution to certain states are now mandated to be taking temperatures along with all the other states. That is our best practice and desire to be taking temperatures. So more information will be coming out today and tomorrow about that.
Thank you, Linda and Brandon and Emily. I have two more questions that are in the queue, and both of those questions are regarding hazard pay. The first one is, why is it the staff at shelters and other programs that are at high risk not receiving hazard pay?
So hazard pay, as we define it right now, is for those situations where there is an active COVID situation. The policy came out, I can reshare that if anybody needs that. But any program that finds itself dealing with an active COVID situation is falling under hazard pay. So it may be in your particular situation who asked the question that there is an active COVID. And if there is and you're not receiving hazard pay, the way that we're working it is the unit director, financial manager, service line director are really getting together for each particular situation and determining when it's effective and who is receiving it.
Thank you for that additional clarity, Linda. It sounds like the response you provided captures the question that I'm about to ask. And I just want to make sure I'm asking the question, and you can go ahead and confirm if you already answered it. When DCS is being sent to different homes and find out one home they have worked in has someone tested positive there, simply, would that be considered hazard or incentive?
I would ask that we talk that through in a team meeting because it gets extremely complicated. So if you feel like you have a situation where there's a question, reach out and let's get a group together to figure that out.
Great. Thank you, Linda. So I've just checked my queue and it appears that we have processed all the questions that have come in. I just wanted to wrap up the Q&A process and then pass it back to Marco for our wrap up for today. Perhaps you're wondering, if questions are coming in through the chat, why do we have the questions centralized, or why not have the panelists just answer the questions from the chat? The committee worked on this process because we understood that there were questions coming in from different venues. So to best coordinate all the questions, ensure that we are answering as many questions that come in, we thought it important to centralize the questions, have one person ask the questions to the panelists. So I hope that this process is working for our staff and employees, because it's one way so that we can get answers to all the questions. So I just wanted to provide that clarity regarding the process that we've used. In addition to that, as stated at the beginning, the goal of this meeting, or the purpose of this meeting, this call, is so that our workforce has an understanding as to how we're responding to COVID-19. We hope that this format is helping in the way in which we're providing information, as well as fielding and answering questions. We'd still like to hear from you. So through an email, along with your questions, let us know how this is working for you. Are you getting the information that you need? Is it helpful? It could be an email that you send to the COVID-19 email address. With that said, I'm going to pass the baton back to Marco, who will wrap us up for today. Marco?
Thank you, Sean. And I want to thank again all the panelists and all that participated today. You continue to ask great questions. You continue to get information that is important to all staff in front of us. So that way we can continue to work together to move forward through this pandemic together. So I'm hoping today's session was informative for everyone that was on the call. I ask that you share what you learned today with your coworkers, knowing that, again, we cannot have everybody on the call that this information is important to. And I ask you to continue to reach out to anybody on the panel that you see in front of you, but just as important, your own programmatic leadership, your supervisors, your managers, your directors, or anybody in leadership if you have any further questions. In closing today, I'm sure many of you saw on Friday the email I sent out about Kevin Roberts passing. Kevin was an awesome person. His enthusiasm for the work we do was evident in his contagious smile and his commitment to advocate for the people we serve in any way possible. We are all going to miss Kevin greatly. So I wanted to close today's meeting with a phrase that Kevin deeply believed in, and it was reflected in all that he did. Simply put, together we're better. Thank you, everyone. Have a great day.